In this lecture, we're going to look at the structural classification of joints. So we're going to reclassify, but this time based on how the joint is constructed. And then look at some of the types, look at the particular construction of synovial joints, one of the structural joint classification groupings. So joints can also be classified by their structure into one of three groups: as a fibrous joint, cartilaginous joints, or synovial joints. Fibrous joints unite the bones with a dense fibrous connective tissue. Has lots and lots of collagenous fibers, and those fibers extend from the bony matrix of one bone to the bony matrix of the other. There's no joint cavity around a fibrous joint, and because of this construction, they are either immovable or maybe slightly movable. And there are three types of fibrous joints: syndesmoses, which look like this; sutures, which are this choice; and then last of all, the Phocis that holds a tooth into its bony socket. So a syndesmosis holds the bones together, but they're not touching, by a sheet of the fibrous connective tissue, in which case it is an between osseous bone membrane, so an interosseous membrane, or by a bundle of dense connective tissue, and that would be an interosseous ligament. So it's either a bundle or a sheet of this dense fibrous connective tissue. And it can allow slight movement all the way up to very considerable amount of movement. And we see interosseous membranes between the radius and the ulna down at the distal end, which is what this illustration is showing, and between the distal end of the tibia and the fibula. And then we're seeing here between the tibia and the talus, this is in this image here, between the tibia and the talus, there is an interosseous ligament, this stretch here of dense regular connective tissue. So we can see these kinds of connections, but again, there is no joint capsule. So this is all external to this. This is a synovial joint here between the talus and the tibia. So it's not. This ligament is external to the synovial joint. A suture, like the ones that we find in the skull, are where the bones are united by this very thin layer of dense fibrous connective tissue known as the sutural ligament. The bone itself is also highly, highly folded. And so this is sort of like locking your fingers together. You get a lot of surface area for this relatively thin sutural ligament to do its work. And you can see, I like this picture where they've separated the bones, so you can see how highly folded that joint is, to allow lots and lots of surface area so that those sutural ligaments can be strong. Fontanelles allow really great movement of the skull plates of those bones during birth, but eventually that fontanelle, that soft spot, will be replaced with a suture as bone forms there where the membranes of the fontanelle are. And so this would be a wormian bone here that has developed in the sutures. This looks to me, I'm not sure exactly where in the skull we're looking at, but it looks like it's down at the bottom of the skull at the base where the occipital and the parietal bones come together. So a Phocis, last of all, holds the peg of the tooth into the socket in the maxilla or in the mandible. And it's composed, here we're looking at this This is a microscopic view of it, a slice through the tooth and the bone. And here you can see the fibers of that gum Phocis, where the fibers extend into the bone, and the fibers also extend into the tooth itself. And those fibers form what is known as the periodontal ligament. So it holds the tooth in place while also allowing a bit of movement or give as a person is chewing. And the only place, of course, that you see a gum Phocis is in the oral cavity. So sutures are only found in the skull bones, gum Phocis only found in the mouth. So those are the fibrous joints. Now let's take a look at cartilaginous joints. In a cartilaginous joint, the articulating surfaces of the bone are held together either by hyaline cartilage, like we see here in the costal cartilages of the ribs. So there's some hyaline cartilage, or by fibrocartilage, which is what we see at the intervertebral discs here that are found in between the vertebrae. Again, no joint cavity, so we don't have a capsule surrounding this joint. And these cartilaginous joints allow a little bit of movement, or they may be, relatively immovable. So, there's a range, I would say, and the intervertebral discs probably provide the greatest amount of movement of any of the cartilaginous joints. So a syndesmosis is where the bones are united by a band or a plate of hyaline cartilage. These syndesmoses will ossify with age, and they permit the the growth of the bones that are being connected. So, for instance, the epiphyseal growth plate that we see here is a syndesmosis that allows this end of the bone to continue growing until it becomes ossified. So eventually, as we talked about back in the bone section, that will become fully ossified. So some locations where, and they permit they may permit what am I saying? Never mind. They just permit growth. That's all they permit. So where we see these kinds of syndesmoses are at the epiphyseal plate, at both the distal and proximal epiphysis of a long bone, and in the cartilage between the first and second set of ribs. Between the first set of ribs and the manubrium of the sternum. So if we go back here, this is a syndesmosis that over time will become ossified. A symphysis is a disc of springy fibrocartilage covered with a thin layer of hyaline cartilage. So it has a little bit of hyaline cartilage around it. When someone ruptures a disc, that hyaline cartilage breaks, and some of the springy fibrocartilage is forced out through that breakage. And we find symphyses between the vertebra. Those intervertebral discs are a symphysis, and in that case, the fibrocartilage there helps to absorb the shock that is placed upon the spinal column when we walk. Just taking a step places a fair amount of stress on the spinal column. But when we're jumping and running, then we really aggravate, really increase that stress a significant amount. The pubic symphysis, sometimes referred to as the symphysis pubis, that would be the official name for it, between the pubic bones is another symphysis joint, and again, that's the fibrocartilage that, late in pregnancy, an enzyme is produced that helps to structurally weaken a symphysis by going and digesting some of these protein fibers, and allows for a little bit of stretchiness and movement during childbirth. Then last of all, in the structural classification scheme, are the synovial joints. And synovial joints allow the articulating bones to move very freely. And that articulation, that joint area, is enclosed by a membrane of dense, irregular connective tissue called the joint capsule that encloses the joint cavity. So here's the joint cavity. Here is everything that's kind of bluish. So the bones are bound together by a fibrous capsule and by ligaments that are external to the capsule that reach across. So we have ligaments and the capsule that are holding it together. Sometimes the ligaments can be internal as well. And the bones are separated. There's a slight distance between them by a space called the joint capsule. I'm sorry, that by a space here that inside the capsule that is filled with the slippery synovial fluid. So to recap, just to make sure we got this, bones come close to each other. They're not touching though, and they're held together by the fibrous capsule and by external ligaments, and separated from each other by a nice amount of a very slippery fluid, the synovial fluid. So let's look at the anatomy then of a synovial joint. The articular cartilage is the layer of cartilage that remains even after the bone is fully ossified, that provides a nice, smooth, very slick surface that covers the bone, so that there is no, even if the bones were to come into contact with each other, they should have that very slick surface so that they would slide easily past each other. The joint capsule is two layers of connective tissues. There's the external layer, which is a very tough fibrous capsular connective tissue that is continuous with and kind of embeds into the periosteum of the bone. There's an internal lining to the joint capsule, shown here as this blue line that I've just colored in red, and that is the synovial membrane, and it's areolar tissue that covers all the surfaces except for the hyaline cartilage inside that joint capsule. And it has the ability to both secrete and reabsorb a fluid rich in proteins called the synovial fluid. And there may be some adipose tissue in here as well that forms a fatty pad inside of the joint. We'll talk about those fatty pads and their function in a minute. All right, so the joint capsule is what produces the synovial fluid, and it's areolar tissue there that's lining the interior of that capsule that's producing the fluids. There we go. Ligaments are external to the joint capsule, and they attach bone to bone. So here's a ligament, and it reaches up here and connects to this bone. And it also makes a connection back down here to this bone. The joint cavity is the space inside of the joint capsule that separates the two bones, and it is filled with the slippery synovial fluid, and that synovial fluid is slippery because it contains a lot of the proteins albumin and hyaluronic acid. And so the protein albumin, and then this material that's called hyaluronic acid. And it helps to reduce friction between those smooth articular cartilage surfaces. But it also supplies nutrients because it's enriched with nutrients from the cells that produced it. And it supplies nutrients to all the cartilage cells there in the interior of the joint, and is also responsible for carrying away or removing the waste material that's produced by those cartilage cells. It also contains phagocytes, so we have white blood cells there that will come along and eat, that will do endocytosis of whatever debris is in there that shouldn't be in there. So debris frequently occurs, little bits of cartilage may flake off, and that has to be cleaned up, and it's the phagocytes that do that. A tendon would be another strip or perhaps even a sheet of collagen-rich connective tissue membrane that connects a muscle to the bone and helps to stabilize the joints. So the tendons around the joint, along with the action of the muscle itself as it contracts, will help to stabilize the bones within the joint, make sure that they don't move around. The fatty pads that we were talking about that are part of that synovial membrane, so here's a fatty pad, here's more fatty pads. As the joint changes shape, that fatty pad is capable of altering its own shape, so it's malleable and it can alter the shape. And it helps both to provide cushioning and to allow for the redistribution of the synovial fluid as the joint moves and the interior spaces within the joint change shape. A meniscus, or if it's plural, menisci, so meniscus would be the singular, is, if you look at it from the top, it sort of looks like a donut with the center missing. If you look at it from the side, it looks like this, these two wedges of cartilage, but again, they're, if we think about them in the background, they're connected to each other. So this is what a meniscus is, and it has these this wedge shape that extends where the wedge extends into the capsule space, the joint cavity. Then it also helps to lock into position two or more bones that are articulating against each other. So it provides a stabilizing effect and helps to improve the fit of the joint, and hopefully reduces the risk of dislocation. If you've heard that, it's a common sports injury to get a tear in the meniscus. Usually it tears from the thin edge toward the thicker edge. And then once that tear occurs, this flap then can flop upward or down, depending on which way it gets moved around, and that can cause very severe pain in the meniscus, in the joint itself, and has to be repaired if the person is going to resume walking normally. Okay, and then to wrap things up, I believe this is our wrap up slide. Yes, it is. There also may be additional structures in the joint that help to either stabilize or ease the movement of that joint. One of them is a bursa. A bursa is a flattened fibrous sac. It's lined with a synovial membrane, and so fluid fills the bursa. And these bursae develop so they're not present in every person, but over time and with age, they will develop in sites where ligaments or muscles are rubbing against the bone. And they develop there as the body's defense against this rubbing that could damage the bone. And so you wind up with a little pad called the bursa that exists there around or perhaps even inside of a joint. And bursitis is inflammation of these bursa. So if you've ever had bursitis, you know that bursa can be real painful when they become inflamed and swell and force their way around or push the joint out of alignment. But they develop as a protective characteristic of the joint. And then last of all are tendon sheaths, which are just elongated bursae that completely wrap around a tendon. So here you can see a tendon sheath that wraps around a tendon, again helping to reduce friction around that joint. Here would be, by the way, a bursa, the subacromial bursa. So that's in the shoulder, and it is padding the movement of the joint against the acromion, or the acromial process of the scapula. So there we have it. All of the characteristics of the structural classifications of joints, along with a description of all of the components that make up a synovial joint. If you have questions, as always, don't hesitate to contact me either during office hours or with an email. And if office hours don't work for you, I'm always happy to meet with you at some other time. I'm on campus for much longer than just teaching classes.